Morena anō. I did ask Bev because the Minister was scheduled to speak till 10:10, and so it's 10 o'clock. I said, do you need me to suck up that extra time? I lined up in my household 3 times for words, so I am quite capable of doing that. I just want to let you know a little story. The first time that I spoke at an NGO Council forum, I think we're at Westpac Stadium, and I was looking quite forward to speaking, and I had done all this preparation, and the person who spoke before me was Dame Keriana Brooking, and she was amazing. And as I was listening to her, I was slowly sinking in my chair, thinking there is no way I'm going to be able to be better than that, and I wasn't. The interesting thing, though, for those of you who have met Dame Keriana, is she has a very serene face. But within that serenity, she can show you whether she's feeling what you're saying or she's not feeling what you're saying. And as I was speaking, she looked at me, and then sometimes I get a little side of the head, a little shake. I looked down, and I was knowing I was going no place fast. And then at the very end, I did get a wee smile. So I think I must have rallied towards the end. But the same thing happened. I think for those of you who were there, morning tea was late. And I was asked to answer 3 questions. And then it was later. And I ended up answering 12 questions. And each question got harder and harder and harder. So I ask of you today, if I get questions, can you be kind? So firstly, I want to thank the Honourable Dr. David Clark, our Minister of Health, and also our Associate Ministers. As DDG, I've got to spend a lot more time with them, and they are great, great people. Great people because they are extremely interested, as they should be, in their portfolios, but there's some kind of value-based authenticity about the things that they're interested in, and I do enjoy that in our conversations. I also want to congratulate Beverly Tahuya for becoming the Council's chair and stepping up to the challenge. For those of you who don't know, Beverly does amazing stuff in the Hawke's Bay, in Māori health, and in an area that's very close to both of our hearts, midwifery. I also want to acknowledge Donna Matahaere Atariki, who was the most amazing chair of the previous council. And when she rang me up, fired up, there was nothing more spectacular to listen to and be engaged in. And I no doubt imagine that she'll still continue to ring me to this day. I do also want to acknowledge the NGO Council. The work that they do is way, way above and beyond the things that we need them to do, and I thank them for that. And all of you know that we don't have a heck of a lot of spare time in our lives, and yet this group, every month, every day, every year, step up to the conversations and the challenge. And I do make time every time they meet to come and talk to them, because it's good for them and it's good for me. We do have the official conversation, and then over lunch we have the unofficial conversation. And we get to engage in conversations about things that are troubling all of us, opportunities that we are looking forward to. So I really appreciate the time and effort that they spend. Dr. Ashley Bloomfield can't be here today, our Director General of Health. And even if he was here or not here, I would want to say I really enjoy having him as my boss. And for those of you who have had the opportunity to meet with him, he is really firm, and he's really fair, and he's really passionate, and he's really caring. And I think those are all the types of things that we'd like to have in a boss. And I think we're incredibly lucky that we have a DG of Health that displays all of those characteristics. For those of you who spent the time to watch the 9 hours that Dr. Bloomfield spent on the stand at Y2575, you would appreciate the thought and effort he put in to talking about an extremely serious subject that's actually going to shape the health and disability system of the future. Finally, As I said, I think last year, I'd like to thank the NGO health and disability providers in this room and beyond. And I think I said last year, never does so much get done by so many for so little. And while we do have every year, I have to say, the health and disability budget is larger than last year. And I imagine next year it's going to be larger again. But it never quite feels like enough. There's nobody, I think, who's saying to me, Keriana, no more. Thank you, I've had my fill. So if that's our life, if that's where we are, it is for some people an incredibly tough road to get to where we need to go to next. And so while you're on that tough road, I want to acknowledge and thank you. So you're going to, as I said, get the opportunity to meet a number of new executive leadership team members today. And so I don't want to crash into their thunder. I'll let them speak for themselves. But I do want to say, I think other than Dr. Andy Simpson, out of the 14 executive leadership team members that we have at the Ministry of Health, Dr. Andy Simpson and I are the only two that have been there before March last year. So this is a new group. Not a new group to health or disability, but a new group to the ministry. So it gives us an opportunity, but it also means for some of you in this room, you may actually have more experience in understanding the machinery of government than they do. So for us, it's a bit of a give and take. What can we help you with, and what can you help us with? They're all committed and motivated to do the very best for the ministry and for the wider health and disability sector, and I hope you get to see that in the way that they discuss these things with you today and the opportunity you get to speak with us during the day. We're currently discussing our stewardship function within the ministry, and I'm incredibly interested to see what people outside the ministry think that means and what that would look like. So I'm inviting comment from you and from the NGO Council on how we feed your thinking into those conversations. I think that the ministry can do a better job of articulating what our leadership and stewardship role is. A lot of the time, we get told, this is not your business, keep out of it, at the same time as we get told, this is your business, why are you not more involved? So there's something about autonomy and accountability and support that we've got to get right, and we've got to be bespoke about it. One size doesn't fit all. So we've talked, haven't we, in this room for a long time about making sure that we get the right services for the right people at the right time. And some people would say that that was an equity statement. However, we've been saying that for a long time. And so we know what our equity, access and outcome performance is, and we've got a long way to go. So if we imagine that we are working on the right services for the right people at the right time, are we also thoughtfully thinking about the services that are needed the most for the people that need them the most at the right time? And that's a slightly different question, and I'm hoping we will get a slightly different answer. So if we're really thoughtful about what equity means to us and what changes we might need to consider, there are going to be some tough and potentially uncomfortable conversations that will need to be had across the system about what needs to change. And from our perspective, we've been doing a lot of thinking about equity, a lot of thinking about the treaty, a lot of thinking about what might look different. And we also encourage and invite people to also feed in on those types of conversations. While I'm the DDG of Health System Improvement and Innovation, I spend most of my time in the area of sustainability. It doesn't feel particularly about improving, and it doesn't particularly feel about innovating. It actually is just about making sure that we're keeping services afloat. So for me, there is something about whether or not we have to have the big change or a series of incremental changes. The last time I met with the NGO Council, I did say, how are we going to get through the next 2 years as a system without eating each other? The mental health announcement seems massive, and yet for those who were around when the blueprint money came out, we had both success and we had both an unhealthy competition. And so how do we behave when A, there's a group of people within the sector that desperately need, and their whānau desperately need better from us? How do we behave better to get better? And for those that have to wait, how do we also not eat each other on the small amount that feels that we've got left? And how do we, in the end, in doing all of that, make sure that the dominant doesn't prevail if the dominant isn't giving us the services that we need? So these are quite big conversations that we need to get to the end of. I did have a bit of a conversation, as I said, with the council about this, and I did a bit of reflection after Barbara made the comment that she's, I think she said 10% rogue, and that sometimes out of that really dynamic throwing it up in the air, it sometimes feels dysfunctional, it sometimes feels disheartening. We do get great progress. And I said, yeah, I'm quite up for that, but I just really I want to be clear that people don't get unnecessarily harmed along the way. And that's not just our people of Aotearoa, but our providers here in this room and outside of it. So I do want to just touch briefly on the Health and Disability System Review, and I know that Lloyd and Sharon are coming along. One of the things that's interesting to me is they are going to get a phenomenal amount of information from you all and from others, and they're only going to do something with some of it. And some of it's going to be longer term, so what are we thinking about in relation to now? And so I have had the opportunity to probably see about half a dozen submissions from providers or professional groups. They've sent me a copy when they've put their submission into the review. I think that's incredibly helpful if you are intending to send a submission and you feel comfortable about sharing it with your ELT portfolio holder in the ministry. I encourage you to do so. Why I say that is because over this year, next year, the following calendar year, we're still going to have to do policy and we're still going to have to make funding decisions. So all of the things that you think are good ideas may not make all the way to the review. So it would be helpful if we also had an opportunity to see where you're heading and what you're thinking about. So just a little bit about the directorate that I work in. I have 4 areas that I look after. So service improvement in the area of primary care, ambulance, maternity, pharmacy, telehealth and healthy ageing. I also look after the regulation teams. So that's MedSafe, Health Cert, Ethics and Radiation Safety. I look after the data analytics team. So those are the teams that do the New Zealand Health Survey, the Global Burden of Disease work, the Cancer Atlas. They do all of the analysis and modelling of service data. I also have picked up the research and evidence area. So that is the evaluation, the way we manage information, the health research strategy, where we're heading in research, how we disseminate learnings, and what kind of insights are we getting from the people of New Zealand. Now that is an area that I think is incredibly immature in the ministry, and it may well feel immature out in the sector. And I don't think it's because people want it to be, but in the last 10 years you may or may not know that 90% of the funding that's spent in health research has been spent on clinicians doing clinical trials in clinical settings. And while that is important, there is a far greater set of research questions that need to be asked and answered. There's something about design. There's something about non-clinical services. There's something about people. that might be missing in that. So where do we want to head for research? So we're one of the bigger directorates in the ministry. I have about 190 staff. And our vision is about learning and delivering together to support pai ora, healthy futures. So just to give you a bit of a hint on the type of work that we've got underway in our directorate, and I'm hoping that most of the DDGs that are coming today will also be able to talk about work that's going on with them. So one of the questions that we're thinking about at the moment that I know some people will be interested in is, what do ambulance and transport services look like in the future? For some people in New Zealand, when things get really tough, it's in a helicopter. For other people, it's in a fixed wing. For other people, it's in an ambulance. For some people, it's actually driving. Sometimes they drive themselves, sometimes the health system drives them. We've done a piece of work on the transport and accommodation policy. So where do we head? What do we expect as New Zealanders in this area? And what do we expect in the next 10 years? As some parts of New Zealand, the number of people gets smaller. In other parts of New Zealand, the number of people get bigger, but still they can't get from A to B. Secondly, it's been a long time since we've had a look at maternity services. And for those of you who've been following the media at the moment, it's a very hot topic. Where do we want to go to in primary maternity services? How do we want them to be delivered? Who do we expect to be working together? How much funding should we have available? I'm also responsible for the implementation of medicinal cannabis. Not something that I've had a huge amount of experience in, but is going to be something that's going to change the way New Zealanders receive medicinal cannabis, and something that I think for a lot of people has been a long time coming. So we're about to go out for consultation very shortly about what the pharmaceutical grade is of medicinal cannabis and how is the best way that people may access this. So just to give you a bit of a hint of that. And then finally, for those of you who work in the older people healthy ageing space and who generally say it's important that the government does focus on child wellbeing, we are all gracefully getting older. And where we need to go in relation to our older people still remains incredibly important. So what is the type of things that we need to recommend to our ministers about what's important in the healthy ageing older people space? So that's just a bit of a summary of the types of big questions that are being answered and asked in my area. I've also had a talk with the NGO Council, and I do know there's a panel this afternoon about commissioning. Commissioning different from purchasing. And the NGO Council over the last 3 or 4 years have done a lot of work in this area. And for those of you who remember the Productivity Commission report in 2015 on commissioning in the social sector, what are the things that we need to do differently? So certainly in the area of commissioning and in the area of stewardship, for those of you who have followed, the claimants in stage 1 of Y2575 put up a number of recommendations about what they felt needed to look different, from legislation, from strategy, from policy, from purchasing, workforce, technology, quite a smart piece of work. And so from our perspective, we really welcome that type of thinking and feedback from anybody here in the room so we can actually add it to that conversation. So in conclusion, thank you for being here. Thank you for your hard work. I actually just want to acknowledge our signers. So thank you guys for coming. I just want to put a little bit of a plug in for the work that they do. The reason why I do that is I did speak to them about the fact that our youngest Tiahu is currently at Victoria University studying te reo and sign language. And for those of you who have children of that age and they seem to have some kind of mid-university existential crisis about what it is that they want to do or not want to do. And so 6 papers to go, his father and I are both crossing our fingers that he's going to get to the end of it. And I said to these guys, even if he does in the end decide to be a carpenter, we are extremely pleased, because I understand there's a very small number of signers who can do sign and Māori sign, and also understand te reo. So can you all please keep your fingers and toes crossed for how that's going to turn up in our family. As the Minister of Health said, you're vital to the success of the health and disability system, and I look forward to spending the rest of the day with you. Tēnā koutou, tēnā koutou, tēnā koutou katoa. I just asked, shall we take questions? Come on, Isis, I know you've got one within you. Oh, Paula? No, I think a mic's coming your way, darling, even though I know you've got a big outside voice.
Oh, kia ora, and thank you for that broad introduction, really appreciate it, Keriana. Where does general purchasing and buying sit? Where is that in the ministry?
Yeah, so I mean, I want to say it sits everywhere, which for those of you, particularly for those of you who have multi-appropriation, so we purchase more than one thing off you, can be both incredibly rewarding and incredibly frustrating. So I think that more broadly, commissioning policy sits with our strategy and policy area. And I do know that this government, broader than health, although health and disability is the largest funder of the NGO sector, but this government is particularly interested in NGO sustainability. And for those of you who have trialled or have advocated for longer contracts, longer certainty of what is being purchased, longer certainty of annual uplifts, the way in which you can describe services without having huge compliance costs. There's a number of areas of purchasing which have come to our attention more than once, and I think there'll be people in this room that have been involved in more than one pilot on commissioning for outcomes, et cetera, et cetera. I think we're coming to a crunch point, and the reason why I'm particularly interested in this is because if we do again move in the policy area of closer to home, or moving more purchasing further down the continuum, then we're going to have a thriving and vibrant NGO sector to be able to receive that. And I don't want that to not be happening because the system, not the providers, the system's not working in the way that it needs to. Thanks, Peter.
Peter Barnett, can you tell us what's happened to the Commissioning for Outcomes framework?
The mental health, or just in general?
Mental health and wellbeing.
I'm probably not the best person, but Robin's coming towards the end of the day, and I will tell her that you are going to ask that question, and I'll get her to do it in her presentation. John Farnger said, nice deflection. It would be better to come from Robin's mouth than from mine.
You mean she'll tell me something more nicely? Or?
Oh, no, she'll tell you something more knowledgeably than me, because it sits within her area and not mine.
Okay.
Thank you. Thanks, Peter. Sonia. Oh, thank you. Oh, you can't get through the tables. Coming.
Kia ora kiriata. Thank you for that. Shane Nahu. Thank you. Just note that unfortunately we don't seem to have anyone from the Population Health Directorate, DLT, speaking to that, which is one of the bigger funders of a number of NGOs and the whole commissioning space. Just wondering if there's a reason why.
I'm not sure what the reason was for putting the people together. and I'm looking down at my person from the ministry and she's not sure either. I'm not sure if it was availability or time on the agenda. But yes, I do accept that the population health area is a large area, and if there is anybody that particularly wants to talk to me, or I'm going to just name drop my lovely colleague over here, Grant Pollard, who's here from the Population Health Directorate, we can perhaps pick up some of your questions during the off-agenda parts. Thank you. Kia ora.
Kia ora. Gordon Jackman's my name. You have an innovation department there. I just wonder if you could tell me how that's going in developing a pathway for innovation.
Yeah, I tell you what, innovation at a national level, particularly non-technology innovation, is quite tough. And that's why it's been added into my portfolios, but I would have to say that it's the second to research in terms of maturity, it's the toughest area that I've got to work on. And why I say that is because a lot of the, I'll say a couple of things. A lot of the innovation I see in some areas is incredibly innovative for that area, but business as usual in somebody else's area. Sometimes the things that people are working on that are incredibly innovative are actually the secret sauce to the innovation is the personality and the people, not the process and the outcome. And that's incredibly hard sometimes to translate and spread across New Zealand. And we all know the little gems that we've got in different parts of New Zealand working on innovation. So we kind of go to the technology area. And, you know, we do talk about the technology innovation of the future. And, you know, I do accept that technology innovation has come a long way and will go further. But there is actually something about, for me, service models and experience models that isn't only just about funding. If we got more money, we would be more innovative. It's actually, I'm not sure what the secret sauce is to spread. And so if somebody in the room, and you'll probably say to me, well, Keriana, it's funding, but if someone in the room had some bright ideas that they could share with me, oh, someone's put their hand up. Have you bright ideas or a question? If someone's got some bright ideas about how, for those critical areas, we are able to do innovation spread up and down New Zealand, I would find that incredibly helpful.
Thanks. My name is Sean McNeill. I'm from the Health Quality and Safety Commission, and our whole reason for being is about improvement and innovation, and then sustaining and spreading that improvement and innovation right across the health sector. So if you want to come to an organisation that's full of people with ideas who are collaborating and making it happen, then come and visit the Health Quality and Safety Commission.
I absolutely come and visit the Health and Quality Safety Commission, and I go there often. What I'm talking about is that most people are looking around at what are the seeds that we need to plant in order to move the innovation area forward. What I get from the sector and from the ministry is that people are hungry for innovation with a big I. And so what does innovation for a big I look like? And what would we have to do that is different than what we're doing now? And is that a step too far? Because quite often people say to me that they want to see the big transformational innovation. And so for me, in my experience working out in the sector, quite a lot of the innovation that we've done hasn't been big scale, but it's had good impact and sometimes big impact. Our improvement work we've done when I worked out in the sector has made a difference to those people. And certainly across large parts of the system, we've seen innovation adopted, sometimes earlier or later by most, and that's been important. But what is our big innovation approach that we want to focus on? And how big do we need it to be? That's the bit that I'm really interested in having conversations with people about. Peter, do you get a second question? Gracious. I didn't answer the first one, so you could get a second question. Yeah. No, I do accept that. This is the last question. I do accept that. I feel like I am in a really privileged position because I do get out more, less now I'm a DDG, but more than most, to actually see different things, how they're working right at the front. And we don't all have, sorry sweetie, this is the last question, but I'll talk to you in morning tea. So I do get that for lots of people, they don't actually know potentially what's happening in their neighbourhood, let alone somebody else's neighbourhood, let alone another part of the country. So again, what's the best way of us doing that? I mean, I've seen websites and I've seen ways in which people can drop information in. But there is, again, something we need to do about being able to spread and disseminate in a way that we are not doing now. It's my understanding that only 18% of research that is done actually has what's called a stickability, which means that the results that they've found, even if they're the right ones, only 18% of them get all the way to the end. So for me, there is something about, in a country as perfectly formed as ours, of the size that we are, it's one of those never-ending struggles. So I'll be really happy to talk to people about that in the break. And that was the last question, I'm sorry, but I'll also talk to you in the break as well, two of you. Thank you.